So Marty is going to tell us a little bit more about the great work that ARH is doing. So Marty, it's over to you.
Hi everyone, and good afternoon and welcome to the Australian Rotary Health presentation. Before I start today's presentation, I'd like to acknowledge everyone that helped yesterday with the Professor Felice Jacka Diet and Mental Health afternoon tea. It really was very much a team effort, especially by so many people, as I'm a novice at this. As Mark said, you've been sent a link as it was recorded. For those that attended, I'm sure that you would agree it's very much worth watching and sharing at your clubs. As District 9820 Rotarians, we have the honour of being the pioneers of Australian Rotary Health. Many of you would know that in an effort to tackle the trauma of cot death, it was Ian Scott that convinced his Rotary Club of Mornington that $2 million needed to be raised for SIDS research. With support from all Australian districts and Rotary International, the Australian Rotary Health Research Fund was created. It became our first homegrown national Rotary project. More importantly, Australian Rotary Health is one of the largest independent funders of mental health research within Australia. They're also becoming very, very well known at funding when no one else will. They are at the forefront of the research. They are, for many of the researchers, that stepping stone onto the bigger stage. We fund a broad range of general health research, run a highly successful Indigenous Health Scholar program, and provide rural medical and nursing scholarships. ARH funds new research, often in areas that do not readily attract funding, and shares the research outcomes with the wider community. It has been said to me several times already in my position that mental health in particular, even though it's such a huge effort right around the country in so many different ways, it still doesn't get its fair share of research funding. The Australian Rotary Health is a project of Rotary Districts of Australia, supported by Rotary Clubs since 1981. We have a broad vision to improve the health and wellbeing of all Australians, with an emphasis on better mental health. Chairman Gregory Ross leads an honorary board of 12, working with CEO George Gillett, OAM, and her staff of 5 based in Parramatta. Importantly, really importantly, 100% of all ARH donations are used for research and scholarship programs. Through the generous support of us, Rotary Clubs, Rotary Districts, individual, commercial and government supporters, ARH has funded over $46 million of research for mental health and general health since its establishment in 1981. They've funded over $33 million of research going into their 4 areas of focus. Lift the lid, of course, is referring to the breakthrough by the research, throwing the hat up in the air, opening, acknowledging, celebrating that mental research is being done. We, as Rotarians, should be exceptionally proud of all that's been achieved. To further increase your understanding of this process, please listen to the Research Behind the Lift podcasts available on Google Play, the App Store. They're also on the ARH website. If you really wondering, do we get bang for our buck? We certainly do, and to prove it, just listen to a few of those researchers. Thanks, Mark.
Fantastic. Thank you, Marty. That was really good. And yeah, Marty is new to the role of ARH this year, the district chair, and Marty is really open to clubs, inviting her to come to one of your meetings and just talk a little bit more about the great work that ARH is doing. And as Marty touched on, what a great legacy that Ian Scott left our district, particularly in the forming of ARH, now a nationally recognised organisation. And to think, you know, our district was a part of that. So thank you, Marty. And I am sure clubs will certainly get in contact with you to come and talk to them about the great programs.